we'll go ahead and talk about ways in which you can identify those entities, processes in place that would be helpful for that, and then how you can potentially use technology to help ease these compliance requirements. And we'll give you a brief product demonstration of a solution provided by SureShield that can help automate this process. And just a note, then at the end, we'll take some questions. Please note in your Zoom area, there is a section for Q&A. So please type your questions into that area. And just a note, a housekeeping note as well. At the conclusion of the presentation, those of you who are in attendance, you will receive this content as well as the recording of the session. And I apologize, I was a little bit remiss in getting the recording started right away, but for the most part, all the relevant content will be taken care of in that recording. And then we'll also make an option offer for those of you who may be interested to trial or test out a solution that can help you with meeting these compliance requirements. So actually, before I go ahead and start this, because we've done these sessions a number of times, first of all, this particular act impacts every single provider in the United States, meaning anybody that potentially, even tangentially, could be doing business with the government. But I'm just going to ask a quick question with the folks that are here. First of all, whether you are actually familiar with the McCain Act. And I'm going to go ahead and launch that poll very briefly. If you could go ahead and answer these, that would be great. And then after that, we'll go ahead and get started. Excellent. Okay, so I think what we're finding, and we typically also find with a lot of these presentations that we have done, that roughly more than half the audience is not familiar with the Act. And I see that there are about 30% of the folks here that are. So for those of you that are, I hopefully don't want to repeat a lot of things you know, but we're going to go ahead and talk first about all about the McCain Act itself. So the McCain Act, or the NDAA, National Defense Act, was enacted in August of 2018. And really the intention behind it was the fact that we were having a lot of very private and secure and important information, national information being stolen. And a lot of that was, as you'll see as we go into it, where the focus really is right now, is on the People's Republic of China. A lot of our very critical, important data has been, and continues to be stolen by the Chinese government. And a lot of that happened through telecommunication systems that were used in a variety of different entities. And when we go in and talk about healthcare, you'll see why you'll need to do some work to really get an understanding of what you may have in your own environment. But Congress passed this act back in 2018. And essentially what it says is that anybody who is working with the government or potentially working with the government may not in any way use any of this type of technology provided by these folks. So there were two provisions. There's the 889A, and 889A basically says that the government may not obtain through a contract or other instrument certain telecommunication equipment or services produced by designated Chinese companies or their subsidiaries. So they cannot directly go and contract with any of these or through another instrument. And you will, for those of you who are familiar with this, or not, I would encourage you to speak with your own counsel in your organization to get an understanding of what this could potentially mean. So as we'll point out, in healthcare as an entity actually could be under both of these provisions, 889A and 889B. So 889B came into effect in August of 2020. And it says that the government basically cannot contract with any entity that uses this type of equipment. And that is in regardless of whether it's in the performance of a federal contract. So when I say this, if you were to look, say, at someone that might be a gardener that's doing services at a government entity, what they're doing is gardening. Nothing they have to do has anything to do with telecommunication they may be using or whatever. However, if that particular company has that kind of equipment in place for other purposes, it doesn't matter. The government requires them to get rid of that if they want to continue to contract with the government for those services. So it's pretty broad, and obviously can be hard to understand what that could potentially mean for you. And as I mentioned, the 889 section applies to every sector. When I say every sector, it applies to anybody, any service, any company, any organization that makes, sells services to the federal government, that they're all responsible for not doing this. And all systems your organization use must be checked for prohibited telecommunication equipment. What is required is, in the context of doing any kind of servicing that's, again, even tangential, you are required to submit to the government through the SAM, I think it's a system of the supply system process to of the government, that you are not indeed working with any of this. And again, it applies no matter if your use is outside of the federal domain, or in failure to do this and do this properly can result in some very significant contracts and fines. And really, there's folks that are indicating that there's possibly a very big potential for false claims penalties. So as an institution, if you had submitted that you were not working with any of these entities in any particular scenario, and someone were to whistleblower say that you were or knew that you were, you could be facing a false claim violation as well. And I will say this has been rolled out over the last 2 years. So ramping up the enforcement of this is just going to be starting. So what impact does this have on healthcare? Well, certainly anyone that provides healthcare, administrative services, research services provided to the government all fall within the scope of potentially Section A and B. And why do I say Section A? Healthcare service providers, the government pays a significant amount of money through the Medicare and other systems to providers. So in effect, the government already has contracts with you, contracts to provide services. So under the auspices of this act, the government is not allowed to do that, is obviously not allowed to contract with anyone who are providing these services, and healthcare is a big provider of these types of services, both through Medicare, and then, as we'll point out in another section, other areas within what I would call the federal healthcare provision areas that you as an organization could potentially be working with. So you've kind of got a double concern. One is just in general, as a provisioner of services and someone that receives reimbursement from the government, it's very, very likely that in either scenario, you're going to have to check and make sure first you're not working with this type of technology in any form or capacity, and submitting that and attesting to that with the government. And as I mentioned, 889 applies to entities that merely use the covered products or services, whether or not in the context of a federal contract. So, healthcare is a prime example. You could have a concierge video conferencing or telemedicine service that is paid privately, let's just say. Well, if that telemedicine technology is utilizing any of this banned information, you're technically in violation of the act. So whether or not it's in the context of a contract does not matter. If you have it and you have anything that's closely related to the federal government, you got to get rid of it or apply for a waiver. And that waiver is not a simple thing to do. So this is where anyone that's in the healthcare sectors really has in many ways, this could be a much bigger impact because of the nature of how, in many ways, services are paid for, whether that's a minimal amount for the federal government or a lot. And as we noted, 730 billion was spent on healthcare services in 2019 alone. So what could this apply to? Obviously, you have things like telemedicine, you have video conferencing, you have smart monitors and other types of systems. There are a lot of things and a lot of technology that come into a healthcare, a hospital, a long-term care, whatever that type of provider may be, that could potentially have impact on this. So other examples, again, of where this provision could affect you, outside of just the fact that if you are receiving reimbursement from the government, you are someone that's technically contracted with that government. So if you are an entity that may have providing services or doing services with the NIH, or providing services to the Department of Defense Health Administration, contractors that are doing that would be impacted by this. If your organization, let's say, helps provide services to the Veterans Affairs Department, even if it's under a contract to provide those services, then you are subject to this provision. Obviously, the community care third-party administrators. So beyond service providers, you also have payers that can be affected by this. The veterans care contractors, the TRICARE, as you know, it has to do more with the military. Or as a university, universities receive a significant amount of grants and other things from the government. So technically, any of those are subject to these provisions as well. So it is, again, a fairly broad act. And again, right now, as they've rolled this out, there are not any significant examples of folks that have been fined for this, because it has just basically been put in place. But you can be assured the government, first of all, wants to make sure that our data for the right reasons is protected and not subject to being stolen. And secondly, as we know, they often always look for ways to recoup monies that they've paid out. So think of the type of equipment that you may have in your own environment that will need to be evaluated. You have computers, obviously, you have medical record systems, you have routers, phones, printers, surveillance systems, bedside and wearable devices, smart thermostat. I mean, the whole myriad of different types of technology that needs to be evaluated. And keep in mind, those technologies may have pieces of technology provided by these companies. So it's very important that these things be checked to make sure that they're not in your particular environment. And then again, just stressing that it's all regardless of whether they're used in the context of a federal contract. It doesn't matter if you are receiving any kind of reimbursement or have any kind of contractual relationship with the government, regardless of whether that technology is used for that, it is forbidden or supposed to be banned from being in your environment. So who are these entities? And another thing you can expect, just like the government always does, they start with one area and you can assume that this will continue to expand. So the target right now is on the People's Republic of China, and these are Chinese entities and their subsidiaries or affiliates. And right now there are 6 of them. Huawei, ZTE, Hytera, Hangzhou, Duo, all of these. Right now there's over 200 and I think about 60 or 230 entities that have been identified. So these corporations have subsidiaries, and this is what makes it very significantly difficult to determine, because just having working with Huawei, you may not know who all their subsidiaries are. So, and all of those fall into organizations or technology that cannot be used. So what can you do to maybe begin this process? If you haven't begun to take this inventory already, you should be preparing yourself and your organization to do so. If it's not within your domain, I would encourage you to get with your legal counsel or others within your organization to just have a more thorough understanding of what this all means and what needs to be done. As I mentioned, there will be an attestation process where you'll have to submit to the government that you don't have this in place. So as we mentioned, failure to properly comply can result in canceled or lost government contracts. And think beyond, because of the nature of how a healthcare institution gets paid, obviously it would be a terrible thing if the government came back and said you can no longer accept, federal Medicare reimbursement. I mean, that is a potential. That's the unknowns with this. If you're directly contracted, let's say you're servicing the VA or you're servicing the military health system or those other entities that are there, if you are not complying with this, you again can lose those contracts. And we don't know what type of fines will be coming along, but you can expect that there will be some pretty significant fines along with this as well. So really, what are some of the things that you, in at least looking at this right now, should be doing? Obviously, take a look at the Act and the rules of the Act. Understand those rules and the actions that are associated with the Section 889. As I mentioned, healthcare, because of the nature of how we work with the federal government, could be, in many ways, a lot of other suppliers are going to fall under the 889B provisions. In theory, healthcare could be under both, meaning A and B, because of the nature of how you provide services to the government. Get with the folks in your IT department or your supply chain area and really conduct a thorough system review to determine if your company uses any of this type of equipment. So you'll need to, first of all, as we mentioned, understand not just those major companies, but also the affiliates that are underneath them. If you do identify that your company uses this equipment, you'll have to evaluate the cost of pulling that out. Is it worth getting it out to lose, a potential contract with the government? You'll have to do, cost benefit analysis as to how ingrained is this, and you'd be surprised how much was in. Remember, the initial provision A was the government couldn't do that. So obviously the government had purchased from these entities in the past. And so removing that is probably not the most simple thing to do, but it will need to be done, or you'll need to pursue a waiver while you put together a phase out plan. Important to, from a compliance plan perspective, as we know with HIPAA and we know with others, in educating the employees and others on these provisions is very important, just so that they understand what this could mean. You could have, literally, you could have an employee who bought their own personal computer that was from that organization. And if that is in any way touching into your system, that's technically not allowed. So, make sure that they're educated on the provisions and how you as an organization plan on treating this from a compliance standpoint. And then for those that you are obviously doing direct contracting with the government, you'll have to make sure in any case that you're reporting this to underneath that vehicle and the system for reward management. The SAM is the group that this will be submitted to, and the attestations will be submitted to. And even part of that is not significantly clear right now on the full process for doing that attestation, but it will get more ingrained. And as they roll this out, obviously they'll put more teeth into it. And as I mentioned, while this has started with Chinese companies, you can expect that they're not the only ones that are technically looking at ways to steal information from our company. You can be probably rest assured that there will be others that will be added, first of all, to this that are potentially Chinese entities, and then others that we consider to be hostile nations, Iran, the North Korea, the Russia. And as that happens, then the scope of this will become even more wieldy and difficult to administer. So with that, I'm going to talk to you a little bit about some solutions that can help you with this process. We provide a variety of different modules through our SureShield platform. We have a ComplyShield platform that actually helps you do HIPAA assessments, NIST related things for security purposes. What I'm going to focus on today and show you is a solution that's called Integrity Shield. And Integrity Shield can be used for a number of different issues in making sure you don't have bad players in your environment. Time permitting, I'll talk to you a little bit about the sanctions and exclusions portion that we do that's very healthcare focused. But under the provisions of 889B, we have a systematic process that can help you, first of all, identify in your environment whether you have these, and do that on a continuous basis. So how does the technology work, the Integrity Shield technology work for 889B? What we have done, and actually this is how it works for all of our databases or banned databases that we're checking. We have a backend, we have a database that's updated with the listing of all, in the case of 889B, all the banned entities, the companies and their affiliates. And we update that on a regular basis. We allow you then to match your provider supplier database against that banned entity list. And we've even taken it a step further, depending on how folks want to use it. We have a small utility that can actually spawn in your environment and basically identify what I would call the assets or the in your environment. Every single product or a piece of technology has what they call a MAC address. It's basically a specific ID associated with that particular product, and that product, it's an association with the product, it's association with the company and with the affiliate that provides that. So with organizations right now, with us who are using it, they want to get even more assured. They utilize this. It goes out, it matches and identifies all of those assets, and then it runs a check against the database to make sure that none of those are there. And if there is a match, then you are hit with a warning and a flag that can help direct you to where those are. And extending that, we allow you, because obviously you have your own ecosystem, and then you have your suppliers that are in that ecosystem. So again, this applies not if you have a supplier that's doing something critical for you, they would fall into that requirement as well. So we allow through this solution to actually push that out to your downstream providers and get information as well on that. So it really helps to further assure compliance with this, and it's a real-time solution. So it will generate the information you need to submit that attestation. And again, you're going to have to assume that that's not just going to be a one-time process, because there's constantly new entities that will get introduced into this, whether it's through your own organization or whether it's new entities that fall on the banned list, right? So you can be buying new software or telecommunication or whatever type services, and if they come into that environment and they're not in compliance, then you're technically out of compliance. So it's something that should be done and looked at on a regular basis. So I'm just going to pause here, and I'm going to go ahead and open up our solution briefly. We call it the Integrity Shield, and Integrity Shield for 889B compliance. And it's actually, for the most part, a really simple, easy solution to administer. It will take away a lot of the manual labor that you would need to put into this process. It will automate that process for you significantly, and it will give you, as I said, constant, regular monitoring. So I'm going to exit here briefly, and I'm going to go ahead and open up. And really, it's kind of a very simple process. So I'm here under the auspices of a company called Stanley Healthcare Group. And right now we're in what we call the application. We have several applications, as I mentioned, for doing compliance management, security related management. But I'm in this particular app that's called 889B monitoring. And really, it's what you are presented with is a dashboard, first of all, of your ecosystem. So within my ecosystem, I can look at my supply chain vendors in general, what's in my own network, what devices might be in my vendor network if I've pushed them down, and then it will give me a tally, and it will also give me some information. I've got red in here because, as you can see in this particular demonstration, I have some entities that are banned. So just for your familiarity, right now there's 232 banned entities that are in here. This is part of the list that we continue to update and manage. If I were to click into this list, it generally basically helps break down by those different entities who they are and what their subsidiaries are within here. And again, we check against these when we run the check on the vendor information or on the IP address information. So if I just wanted to filter down and look at who these 40 entities were under the Dahu Technology Company, you can see the names of the different subsidiaries and vendors that fall into that area. When I first went into here, it gave me the full macro list of everything. So there's a filtering component that goes on to this. Now, how does this data get updated? Very easily. There's a couple of different ways. One, if, for instance, you've just contracted or you want to do a check on a new vendor that's coming in, we have a process that allows you to just add a vendor and put that into the system, and it will immediately go ahead on in and check that vendor against the database. Again, that's at the, as I said, the level of the vendor itself. You can also upload. We provide you a little CSV, or we can also API or interface into anything that might be a supply kind of database that you have, and update that so that it's constantly updated. But you can upload a CSV or an Excel file, have that in your vendor database for you as your vendor, you as the vendors that you're working with, and then it will of course go ahead on in and check against those. And then, as I also mentioned, there's a couple of different ways to be even more detailed, meaning there's a small, what we call scanner, or a scan utility that can go out and basically identify all the IPs or IT devices in your network and match those to MAC addresses that will then get matched up against. So it will be the actual specific piece of technology as opposed to the company. And a lot of folks like to use that because it's, again, it's more thorough in nature. So you can go ahead and download that particular scanner, work through that, identify those, and again, it will do an immediate match to let you know if you have any red flags in your environment. And then lastly, you also have a way to push this down to vendors within your environment to have them check against their own ecosystem. So it basically would be clicked on, and you can send out a request to them to take more action or to do this particular process. So once that's done, as I mentioned, this filtering tool allows you to do the matches against what's in there. So in this case, I'm looking at the supply chain vendors I have. There's 102. If I wanted to just look specifically at those that were the banned entities, it will tell me who they are. If I had done the MAC address IDs on them, then I would know what specific piece of technology that was, and I would be able to go in and take action to remove that from my environment. And that's kind of shown a little bit in here. If I were to look at the full-on network devices, you can see here's where it will identify that MAC ID. And then it becomes very easy for my IT folks, or for me to say, you know what, we need to remove this particular piece of technology from our environment. Obviously, first understand what it's being used for, but get it out, because that in and of itself would make you in non-compliance with the 889B provisions. And again, what makes this extremely useful is, first of all, there's very little effort that you have to go into to run this, and it's constant. So as new things get added, whether it's on the banned entity list or you're adding new providers or vendors, it will immediately run those checks for you ahead of time to make sure you're not putting yourself in any kind of jeopardy. And as we may have a minute or two more, because a lot of folks here are from the compliance area, I'm just going to point out, even though this is not necessarily related to 889B compliance, that let me just check briefly. I did mention that we also have this as a tool that can be run in a similar way for sanctions and exclusions checking as well. So for those of you who may be familiar with that process, as you know, you are supposed to be checking your employees, your entities, your contracted entities, and any individuals to make sure that they are not excluded from working with the federal government, whether federal or state entities. So I'm not going to go into this in any kind of significant detail, but operationally, it works very similar to the 889B, meaning we have a full automated sanctions and exclusion database, and we're constantly checking all the folks within there that are in your ecosystem to make sure that they're not falling onto that list as well. And as you know, particularly if you folks are on the compliance side, if you are indeed operating with a banned vendor or a banned individual, that itself from the clinical side can result in some pretty significant fines from the federal government as well. So these solutions all run on the same base technology platform. So I'm going to go back to our presentation briefly, and we're getting ready to wrap up here. Hopefully, we've perhaps bought you back a little bit of your time today, but we will go ahead and take questions. So, what can the Integrity Shield solution do for you? Obviously, there's significant ROI in terms of identifying potential banned vendors, lowering your cost of having to go through that validation and checking process. And again, if for those who are not necessarily familiar with the McCain Act, I hope this has helped you to some degree. And I would encourage you to go back and make sure that you thoroughly, have a good understanding of that act, and also what potential impact that could have on you as a healthcare provider. Compliance with this is going to be a requirement to continue doing business with the federal government. And you'll need to have good processes in place for adequate oversight. And as we know, there's new threats that will regularly be introduced, and we can also expect that this will be expanded beyond the People's Republic of China. And hopefully you can see with us, there's the opportunity to leverage technology to help make this easier. As we know, as healthcare providers, you are constantly having to deal with new regulatory and compliance oversight issues, and hopefully we can help ease a bit of that burden with our solution to help you with this particular act and this requirement. So we'll go ahead. For those of you that may have questions, please go into the Q&A. As I mentioned, we do have, we are offering for anyone that would like to trial this out. It's a very simple solution to set up. If you have an interest in setting up a trial for you to actually trial the solution, I'll take a brief poll here to see if those are, for any of those that are here, if there is an interest. Please go ahead and respond to that poll. And then while we are doing that, would be also, why don't we go ahead and take any questions that you all may have. And for those of you who are here, please go on into the Q&A area, and that's where you can type in your questions. And great, I see so far we have a handful of folks that would like to trial out the solution. Just as a note with that, once we will reach out to you personally to set up some time to walk through that particular setup for you. It's actually just it's a web-based tool, so it's very simple and easy to get invited into that, which we will do, and then get you set, and really we can help you match up a handful of vendors if you have those to check them against the database itself. So please go ahead. I don't see a lot of questions coming into the Q&A. I do see one that is asking what the pricing is for this. So we price it, it's basically a license for use. We kind of take a look at what the size of the ecosystem is that needs to be monitored. And then there's basically a monthly subscription price for using that. And then I see one other question about, does this provision apply to non-healthcare companies? And of course, the answer is yes. What's interesting with this provision is it's a federal mandate across all the government, whether you are providing financial services, whether you're providing healthcare services, whether you're providing anything. It doesn't matter. Those organizations, if you are contracted or tangentially contracted, you have to comply with the provisions of the McCain Act and 889B. Okay, I don't see any other questions. Again, I'll leave the poll open for a few more minutes for those of you who are still on to respond as to whether you would like the opportunity to try this. And if not, we will, go ahead. As I mentioned, you will get the opportunity to we will be following up with you with the content of the presentation, as well as the recording of this presentation as well. Great. So at this point, then, I appreciate you all joining the session. I hope you found it to be somewhat informative and useful. And again, please reach out to us if we can be of any assistance. Thank you so much for attending the session. We'll go ahead and close at this time.
Thanks, Tom.